Hello, I am Dr. Santosh Gupta. We will be talking about the IVF procedure. What does IVF mean? It is in vitro fertilization. That means egg and sperm are collected outside the body, they are fertilized outside, and resulting embryo is transferred back to the women uterus. So how this procedure is done? Patients are very apprehensive. Should I take bed rest? Should I take leave? So I will answer and simplify it for you. IVF, usually once your doctor suggests you IVF, your basic investigations are normal. Then the lady is called on second or third day of her period. A scan will be done. If scan is normal, there are no cysts, then injections will be started. Why these injections are being given? Because normally only one egg will produce. If we give injection, multiple follicles will develop. Usually these injections are for 10 days. We have to take them daily, but you can continue your daily routine along with the injections. 10th day, if your doctor says by checking through scan that you are ready for the last injection, usually one trigger injection will be given, and 36 hours later eggs are being collected. Egg collection procedure again is a very simple procedure. It is done transvaginally. On the scan probe there is a needle attached, so there is a transvaginal prick. There is no surgery, no cut as such outside. It should not hurt you, you should not feel pain, that's why it is done under anesthesia. Procedure hardly takes 10 to 20 minutes. Once egg are being collected, these are inseminated with your husband's sperm, either through traditional IVF or through the ICSI procedure. That means if you get 10 eggs, in each of the egg your husband's sperm will be injected in. Next day we will visualize whether the fertilization has happened or not. This is all microscopic procedure. On the day of egg collection, after 3 to 4 hours you can go home. Next day we look for fertilization. Another 3 to 5 days we see how embryo develop. These 3 to 5 days you need not to come to the hospital. We will inform you telephonically. Once embryo develop, we will call you for the embryo transfer. 1 or 2 good quality embryos are being selected and transferred back to the uterus. Embryo transfer is very simple procedure. No anesthesia is required. It takes 2 to 5 minutes to do it. Once you reach the hospital, your doctor will discuss about the number of embryo develop and to be the transfer. Once your bladder is full, transcervically from down below, when embryos are loaded in a very thin catheter which is passed through cervix and put inside the uterine cavity. Once embryo transfer is done, you will be prescribed 2 weeks medication. You will be at home for another 2 weeks, and 2 weeks later pregnancy check is done, which is usually a blood test, beta HCG, and we can check whether the IVF is successful for you or not. It's a very simple treatment. You can work during treatment only on the day of egg collection. On the embryo transfer day, you have to apply for the leave or take rest. Happy treatment.